Welcome to the Executive Corner. This is Samantha Olds Frey. I'm the CEO of IAMHP, also known as the Illinois Association of Medicaid Health Plans. Today, we're going to talk specifically about House Bill 158, but more specifically than that, we're actually going to dive into a strong component of that legislation that just passed the Senate and the House and is on its way to Governor Pritzker for signing, and that is the expansion of the Medicaid program to include coverage of doulas. And why does that matter to the Medicaid program? Well, first of all, I think it's critical that we recall that Medicaid covers 50% of births in the state of Illinois. So 1 out of every 2 babies born here is supported by the Medicaid program and that healthcare safety net. And so what we do in the Medicaid program with regards to coverage for births and improving birth outcomes not only impacts those 50% of babies born in the state supported by the Medicaid program, but truly ends up impacting the entire population because Medicaid's the largest payer for births. So why did we expand doula coverage? And the reason is that we have seen time and time again that doulas improve birth outcomes, specifically for women of color. And what do we see that they do? So we've seen from study after study that increased birth weight, which not only, of course, means that it's most likely to not be a preterm birth, but it also means that that child is less likely to have adverse health outcomes later in their life. A low birth weight predicts other poor healthcare outcomes throughout an individual's life. So the more that we can avoid low birth outcomes, the better off that child's going to be in the short term, but also in the long term. We also see that with doula coverage, we see a decrease in cesarean or C-sections. And why does that matter? Again, a vaginal birth means that there's a lower recovery time for the mom, that the mom is going to be able to recover sooner. She's going to be able to care for the newborn a little bit easier, won't be recovering from a very serious surgery, and will be able to return to work and regular activities sooner. And so that is a wonderful outcome as well. We also see a decrease in postpartum depression with doulas, again, sort of increasing that support around that mom means better outcomes. And it's important to note that postpartum depression doesn't only impact the individual, so the mom, but it impacts the baby, any other children, really the entire family. And so when we can decrease postpartum depression, we're not only improving health care outcomes for that individual, but for the entire family. We also see increase pickup of breastfeeding with doulas. And so we are able to see sort of that benefit as well as and the benefits of breastfeeding that have been documented. And so as Illinois begins sort of expanding this coverage, which we anticipate will be sometime over the summer, maybe next January, we anticipate that over the years to come, we'll see improved birth outcomes, decrease adverse effects or outcomes, and really be able to improve the lives of millions of people over the course of the next decade. And we're really excited about the improvement in the Medicaid program by the addition of doula coverage, thanks to House Bill 158. Thank you for joining us today on the Executive Corner. To learn more about IAMHP, please visit our website at iamhip.net, or you can like and follow us on Twitter, LinkedIn, and Facebook.